I think there are a number of innovative elements within our project. I think one of the examples has been the work that Mental Health Matters has done with One North East on encouraging people with mental health issues back into work through self-employment, and they're evaluating each stage of that development through advice, support, and provision of incubator space and that kind of thing. Another element within the migration side has been we found from the early research that migrant populations need information quickly. They're using the web. They want to use the web to get hold of that, rather than traditional means of information gathering. So we have been working on a phone app, an employability phone app, which would be informed by the research and be useful and provide particular routes in for migrant populations. But I think the most innovative part of the project, and the bit of which I'm most proud, is linking those providers who have direct experience of working with the client groups with the universities at Sunderland and Newcastle. And I think putting those two organisations together lead to research outputs and hopefully a much longer relationship which will outlive the project. We've had to make quite a few changes to the project as it's gone on. I think one of the biggest changes has been the demise of the Regional Development Agency, One North East, who are a key partner in pulling it together. And we're going to use them as the main route for dissemination and policy developments. So we are in the process of rethinking that strategy. In terms of the specific activities, of course, we've had to make changes from the initial findings of the research. One of the interesting elements of that has been the focus on employers' attitudes and helping employers rather than the older workers themselves. Especially as the economic crisis has loomed, and we've also in terms of the migrant population, what we've recognised that there are certain groups in the region who are very well equipped to support migrant population. So we've decided to focus on the high-skilled end of that population and look at ways of attracting and retaining skilled graduates, for example, from across Europe. One of the benefits of having a large partnership has been that we have a number of routes for dissemination. So, for example, the Institute for Ageing and Health, along with NIACE and the Years Ahead Forum in the North East, have held a number of very successful conferences around research and their findings about employer attitudes to flexible working and getting older workers back into work. But we've also had a conference with the transnational partners in the Basque Country, which was looking at how to get people with mental health issues into work. And there's been a number of spin-offs from that, and the possibility of linking with volunteering work, as well as specific measures that are undertaken by Mental Health Matters. We actually also had an opportunity to disseminate at the House of Commons just earlier this week, actually. The University of Sunderland was able to show what we've been doing with EU migration research and the activities that we're doing with the North East Strategic Migration Partnership.